Thank you very much, Presiding Officer. Can I start by wishing the Minister a speedy recovery? Presiding Officer, let me open on a note of consensus with the Minister, because every life lost as a result of drugs is a terrible tragedy, and my thoughts are with those who have lost loved ones. In truth, far too many lives have been lost since the Scottish Government declared the drug crisis a public health emergency in 2019. More than 4,000 drug-related deaths have been recorded. And the figures appear to be still rising, as 600 suspected drug deaths were recorded in the first 6 months of 2023, and that's 7% up on the same period last year. And I also very much welcome the announcement from the Lord Advocate that there will be a presumption against prosecution of people using safe consumption rooms, removing the obstacle to providing such a facility on a pilot basis in Glasgow. It will be important to have an early shared understanding of how the facility will operate, what the evaluation framework looks like, so we can measure success and learn for the future. It would also be helpful to clarify what protections there will be for staff should something go wrong. Is their liability limited as well? So I hope the Minister will provide further information as the thinking develops. Let me turn to the SNP motion, and I genuinely regret that we are again debating constitutional issues and seeking to divide rather than to act. Safe consumption rooms were proposed some 6 to 7 years ago. The law has not changed in that time, but the Lord Advocate has acted in a proportionate and, in my view, sensible way to enable a pilot to take place. Why was this not done 6 to 7 years ago? In September 2021, the Lord Advocate confirmed that there was a legal route to pursuing safe consumption rooms. That was 24 months ago. Why has nothing happened until now? Lots of people feel very let down. They are angry about the lack of action and using constitutional wrangling as an excuse. And all this time, thousands more people have died because of drugs. Nicola Sturgeon apologised in 2021 for having taken her eye off the ball, having declared a public health emergency 2 years earlier. But I fear that the present government have sadly learnt nothing. I give way to the Minister.
Minister.
I thank Jackie Baillie for giving way and also for her well-wishes. I would just like to point out that once the new Lord Advocate did take up her position, she did lay out to the Justice Committee the parameters by which she would be willing to look at a proposal for a safer consumption facility. The Scottish Government, Police Scotland and Glasgow Health and Social Care Partnership then worked solidly for about 6 months to actually bring a proposal forward. That proposal went to the Lord Advocate in June of 2022. And I do thank the Lord Advocate for taking the time to actually come to a decision on that, but to suggest that nothing had been done in the intervening time is simply not the case.
Jackie Baillie.
I say to the Minister, and I welcome her intervention, clearly nothing has been done for 6 to 7 years. I appreciate the current Lord Advocate's position, but it's the same Scottish Government, the same policy for a safe consumption room, and that policy has simply not been delivered before. So people do feel let down. You know, the law on drugs is the same in England as it is in Scotland, exactly the same. Every word, every comma is identical. Yet here in Scotland, drug deaths are 3 times higher. So it really isn't the law that is the issue. And simplistic arguments about where power rests are just simply not credible. We need action from government, not more distraction in the form of fights with Westminster. Now, I know the SNP don't like to hear it, but the powers to end Scotland's drug crisis lie in St Andrew's House. This includes power over our entire health system, drug treatment services, mental health services, social care, policing and prisons, to name a few. And don't just take my word for it. The former head of the Drug Deaths Task Force, Katrina Matheson, has said the Scottish Government needs to focus on what we can do now in Scotland without trying to divert attention to Westminster and the Misuse of Drugs Act. David Liddell, former CEO of Scottish Drugs Forum, told the Scottish Affairs Committee, "We certainly do have a frustration that the Misuse of Drugs Act is used as a means of delaying responses." And finally, Darren McGarvey, anti-poverty campaigner, said, add safe consumption rooms to that list of things that were doable in Scotland ages ago. And while I welcome the announcement, we have to be frank and say this is clear evidence of how governments play politics with people's lives. Surely the Minister recognises that these experts need to be listened to. And how does she respond to Audit Scotland, who warned in 2022 in its Drug and Alcohol Services update of a lack of drive and leadership by the Scottish Government? I repeat, the powers to end Scotland's drug crisis lie in St Andrew's House. Now, we know that we are dealing with a complex and wicked problem. We need a clear understanding of the underlying causes of addiction so we can begin to tackle them at their root. We need action to increase the availability and range of support services and treatment. And, we need to recognise that harm reduction, treatment and rehabilitation go hand in hand. The government are very keen to point to the increased amount they're spending on drugs and alcohol from 2019 onwards. What they fail to mention is the period before that, when they cut the budget by £46 million. It is astonishing that they now want us to congratulate them for simply restoring their cuts. Presiding Officer, I also this week got an email from a GP in Glasgow, from the Pollokshaws Medical Centre, just next door to the First Minister's own constituency. He described the underfunding of primary care and the decreasing budget to treat those with alcohol and drug addictions. The Drug Misuse National Enhanced Service is the specific funding stream. Is not grown at all, not at all, in the last 16 years since the SNP came to power. At the same time as the combined rate of inflation makes it well over 80%, so it's suffered an effective real terms decrease. He makes the point that many addiction teams are attempting to move more stable users to primary care so that they can look after the high-risk cases. But, due to this lack of funding, most GP practices are not able to provide the help required. This GP notes that if funding is effectively halved, then care will suffer. And he asks, is it acceptable for this to continue? I put that question to the government. He goes on to say, I really think for the sake of many vulnerable patients and their families whose lives are blighted by drugs misuse, that this would be a positive step towards lowering suffering and deaths. And it's not just primary care services, Presiding Officer. There are services such as Turning Point in Glasgow. They're closing their doors to women with addictions because their budget has been slashed. Local addiction projects in my area have had flat cash settlements for the last decade, effectively a real terms cut to their budget. Against that backdrop, I understand that over £2 million has been identified for the Safe Consumption Room pilot. Can I ask the Minister in closing, will that be additional funding or are cuts being made to treatment services to allow that to happen? Rehabilitation beds were cut by this government, and Scottish Labour supports Douglas Ross's bill that gives a right to rehab. We recognise that it is not in and of itself a silver bullet, but it is an important provision that will help in the fight to tackle drug misuse. And so I hope the government will support it. I'm in my last minute. Since 2007, there have been 13,000 confirmed drug deaths. But this is not the full story, because these figures do not fully reflect the scale of the problem. The Minister's predecessor committed to exploring how the wider range of harms of drugs beyond those where drug overdose is the cause of death can be recorded. And I would be grateful if the Minister would update Parliament on this. Presiding Officer, it takes 7 years to get to this point with the Safe Consumption Room. I really hope it doesn't take another 7 years before we have drug testing services. It's 14 months since the Drug Deaths Task Force reported, and yet no formal application has been made to establish drug checking services. It is simply not good enough. We know that these facilities will reduce drug-related harms by allowing people to get substances of concern tested for content and potency. And then, of course, there's the MAT standards promised 18 months ago, still not fully implemented. Standards 1 to 5 was supposed to be implemented by April this year. That's not happened. Presiding Officer, let me close and let me repeat. The powers to end Scotland's drug crisis lie in St Andrew's House. Stop the distraction, stop the sleight of hand and get on with the job.